Welcome back. Now, today we're joined by Dr. Diran Onifade. He is the CMO of Dr. Connect, and he's here to talk about the risk factors for diabetes. Now, Dr. Diran is interested in developing the state of health in Lagos State. He's using health technology and machine learning to help drive the new trend of the profession in the country, and it's a great pleasure to have him in the studio. Welcome back.
Thank you very much. Yeah, it's nice to be here.
All right, so I do know that on the 14th of November is World Diabetes Day. So this topic actually really does fall in line with one of their themes. But let's talk about the types of diabetes before we touch on the risk factors.
Okay, so there are basically three types of diabetes. We have the type 1, the type 2, and the gestational diabetes. That is the ones you see in pregnant people.
Okay.
So those are basically the three types, and each of them have their own peculiarity and the causative factors. So the type 1, basically you see it in young people, and it's because of the pancreas, they're not producing insulin. Insulin is what you need to convert your glucose, that your body will be able to use it. So when that is not happening, the blood glucose accumulates in the system and gives you diabetes. So that is type 1.
What are the risk factors for type 1?
For type 1. Okay, the risk factors basically is family history. If there's family history, someone in your family has it before, you can have it. Then there are some certain diseases of the newborn, or even elderly too. When you have some disease, it can make you prone to have type 1. So those are the basic things that make you to have type 1 diabetes. The family history is a very strong one. Family history is very strong.
So let's touch on type 2.
Type 2.
Yes.
So type 2 is the commonest. That's what we see most of the time. When you see an adult having diabetes, most of the time is always type 2. So a lot of things can cause it. One of it is sedentary lifestyle. People that don't do anything, from AC to AC, from your office, in your car, you come back. That's a major risk factor. Another risk factor is there's a family history. Maybe you have a brother, a sister, or mother that have had diabetes before. The likelihood that you are going to have diabetes in your generation again. Then another very strong one is diet. Then obesity is a very strong one too. Lots of people, because they are overweight, then because they don't want their diet and all that, it's prone them to have that. And that is that for type 2. For gestational, most times obesity is another very strong part. Then the older you are when you get pregnant, the likelihood that you might have gestational diabetes.
The older, so you're saying it's more high risk for women who get pregnant later in life?
Yes.
Is there anything that a pregnant person can do to sort of reduce those risk factors?
Yes, so we always tell people that even before you get pregnant, you need to try to make sure that your weight is moderate. If you are obese, you know, we have all these body composition analysis thing that will let you know where your weight risk is at. So try to do exercise and reduce your weight before getting pregnant. And even when you are pregnant, there are still some minor exercises you can do. So you won't just get overweight. So that's a very strong one. Then if you know that there's a family history, maybe your mom or dad has this thing before, you need to start doing exercise. Probably you need to start doing checks, maybe once in a year, twice in a year, depending on the risk factor that you have in your family.
Okay, so for people that don't understand what it is that diabetes does to the body, we did talk about insulin levels and all that, but it does sound very technical. Someone who is a diabetic, right, for an onlooker, what sort of symptoms will they see?
Oh, that's a very good question. You know, it can be very silent for a long time. You cannot just know it that this person has diabetes. You first start seeing some symptoms. You go to urinate frequently, maybe over the night, you just keep wheeling, going to toilet and all that. That is one. Then you start drinking a lot of water. Every time you're thirsty, you want to drink, you're thirsty, you want to drink. When you see those signs, you need to go and check your sugar level. And that is what you see most of the time. Another thing, you see some people just start losing weight. They don't know why. They're just losing weight all the time. So that's another. But you will not know except you do the blood test. Probably when you do urine test, you might just pick some sugar there, but the blood test is what gives it away. And it's very cheap for you to get those tests done.
Okay, so when you say cheap, or let's say affordable, how, if for instance you notice any of these symptoms before, how frequently do you believe these checks should be done in a year?
For those that have noticed that before?
Yes.
Okay, so let's divide this into three.
All right.
Those that have those symptoms, but they are not diagnosed yet.
Okay.
Once you have those symptoms, maybe it's borderline, probably the next week you have to do it again. Then when you start being on medication, at least you need to be doing it maybe like daily, depending on the drug. Because these things are things you can do it yourself. They are DIYs.
Okay.
You just do it yourself, just a finger prick, then you know. Then when you are constantly on the medication and it's reduced, there's something we call an HbA1c. It's a glycosylated hemoglobin. That will let us know the sugar level 6 months backward.
Wow.
Retrospectively.
Wow.
So those things are available. Diabetes is one of those things that have been well researched, and there are quite a lot of things that have been done in that space. So as we get into this space over the months, we open a lot of things that have been done in the diagnosis and treatment of diabetes.
Okay. Now, this year will mark, I think, 100 years.
100 years.
Since insulin
has been discovered, yes.
Yes. So, meaning that there is treatment for diabetes.
Yes.
It's not what is considered a death sentence.
There's treatment, but there's no cure.
Wow.
So we need to demarcate those things, because that is one of the things killing our people. And they start having complications. They said, okay, I've been on treatment for a while, now I want to stop. So once you have been treated for a while, you don't stop. It's continuous. It's a lifestyle thing.
Okay.
So you just don't stop the medication, no. Once you're on the treatment, you're on the treatment.
Wow.
Except gestational diabetes that might go away. After delivery, you might not have it again. But once you have gestational diabetes, there's likelihood that you progress to type 2 diabetes.
I have to say thank you so much for coming to talk to us about this today. And it is a very, very serious issue, and many people are going through it. Many people might not have even realized it. Just make sure you see a health professional today if you've heard any symptoms that might communicate with you.